Okay, well, hopefully everyone is logged in okay and they can hear me. Welcome to our panel today on winning work in education and healthcare. This is part of a series of webinars we're running today. We've already had one previous session, which was on tackling RAAC in education estates, and we will have another panel. At 2 to 3 called Unlocking Delivery, Developing the Healthcare Facilities the UK Needs. The webinar we're doing now is called Healthy Places, Blurring the Boundaries Across Social Infrastructure. And we've got a great panel for you today. I'll just introduce them quickly. So we have Paul Bell, partner at Ryder Architecture. We have Nuala Gallagher, Corporate Director of City Development at Liverpool City Council. Anisha Mayer, Director, UK Head of Healthcare at WSP, and Magali Thompson, Project Lead for Placemaking at Great Ormond Street Hospital. So I'd just like to thank our sponsors, Ryder Architecture, and if anyone has any questions during the session, please type them in at any time using the speech bubble, which you should see on the left of your screen. And just to let people know, this session will be available to stream on demand about an hour after it ends. So that's enough for me. So I'm just going to hand over to Paul, who will lead the panel.
Thanks, Tom. Bear with me. I will share my screen, hopefully. Hopefully got some slides up there now. So, well, thank you, Tom. And thank you for the introduction to the session. What we'd like to do is to start off with a short presentation about a provocation project that we've been doing as Ryder Architecture and our partners at Ocana and various collaborators across communities, academia and business in Liverpool over the last 18 months or so, which is looking around an idea which we call Liverpool Green Lanes. So this really is both a provocation and a proposition to catalyse, to connect, to green and to grow Liverpool, addressing health and economic inequality as we do so, and hopefully improving and engaging the city's communities. So Ryder have been in Liverpool for nearly 20 years now, and we've been located in Liverpool's Knowledge Quarter for about 10 of those, and I've had the pleasure of delivering and being involved in many projects around the Knowledge Quarter. And Liverpool really, it's a great city, it's a people place, and it's a place of communities. But a lot of the communities surrounding Liverpool's city core and the Knowledge Quarter are challenged in many ways in terms of multiple deprivation. There are some stark statistics around that, such I'm not going to go through too many of these, but key ones in terms of men in Liverpool in 2023 data living less 3.5 years less than the English average, and women living 3.9 years less. We've got people living in our poorest areas that live an average of 15 years less than people in the most affluent areas of Liverpool, and live 18 years longer with poor health. So these are some really stark statistics that surround the Liverpool's city core. Not dissimilar to many places, we know that. But I think what we were looking at was how can we start to look at optimizing the influence of particularly Liverpool's Knowledge Quarter, which has successfully attracted a lot of inward investment over a long period of time. And how can we start to extend the influence of that out beyond the boundaries of the quarter into the rest of the city core, but I guess more importantly, into the surrounding communities and help to address some of the concerns about health inequality and socioeconomic inequality that a lot of those communities are experiencing. So it started really with a first move, and it was how do we bring the influence of that of the quarter and bring that to the water, so from quarter to water, and really then starting to think about what that proposition might offer. Sets out, we're looking to potentially set out an ambition to promote city living, to promote health and well-being, to promote cultural and civic life, to provide sustainable and maker retail, to improve transit and sustainable transit, provide learning and knowledge opportunities, provide urban food and ecology opportunities, and see how we can start to define some critical paths across the city, linking those areas of needs to the broader city. And we sort of had this idea that we, in doing so, this wasn't about creating a master plan as such. It was about trying to develop more of a movement and an organic network. And we sort of started to look at this idea of a cow parsley, and that might have its roots in the waterfront, Liverpool's traditional core. And then as it grows through its stem and its branches, and it branches out to connect some of the activities which are already ongoing in Liverpool in terms of transformation and cultural activity. But to then sort of those branches and that stem come forward, and the main sort of flowerhead there being the knowledge quarter, and that then acting as an opportunity to disseminate and pollinate across the city's communities, and disperse, I guess, that the impact of the potential impact of that inward investment to a broader suite of communities. So this was about starting to link up activities and transformational opportunities which were along the way. And as I said, it wasn't about trying to create a master plan as such, but it was an example, really. So we selected a route from the water, coming through and connecting up some of Liverpool's cultural amenities, and looking then at opportunities along the way to form points of transformation, and I guess provide those catalysts for future developments to merge. And this recognises very much that there is a lot going on in Liverpool, but it looks to try and build upon that. And I presented some ideas to sort of capture imagination, really. So from the waterfront, how do we extend into the River Mersey, perhaps, and use that for exercise and for pleasure and leisure, have a new connection across the Strand, which still potentially forms a barrier between the city and its waterfront. How then can we look at some of the civic spaces, and Derby Square being one of these, and transform that with green space, and look at pedestrianisation of that city core, taking away traffic and improving air quality, moving up the route through Liverpool's retail core, and looking at the impact of reduced retail demand within cities, and how we might repurpose that. So is there an opportunity then to repurpose some of that accommodation for makerspace, and try to address and give opportunities for homelessness, in terms of employment opportunity or self-employment opportunity, building on Williamson Square and making a transformation there, so that becomes almost a marketplace for makers, and moving up through the topography of Liverpool towards the Knowledge Quarter. Can we transform some of the city's car parking space to urban farms and provide opportunities for growing and bringing communities in there, bringing learning space. The route that we've chosen passes a number of educational establishments, primary schools and universities. So how can they start to branch out, and take some of the public realm as part of their learning space and community space, and creating a series of community gardens as we head up towards that knowledge quarter. And as I said, it recognises that there's a lot going on in Liverpool as a city. So this is about trying to form those connections, and in doing so, amplify the opportunity that those projects can have by bringing them together and looking at agglomeration across those projects. So this is a proposition, I say, which we've been looking at now for the last 18 months or so. And it's been really fascinating as we've been developing this, how so many different organisations and stakeholders have joined the debate, the discussion. That's exactly what we were hoping that would happen. And we've had interest and involvement from Liverpool One. They've been great supporters, Liverpool One being the retail-led mixed-use sort of transformation of Liverpool, I guess almost 20 years ago. And they've brought people to the table in terms of educational bodies, but also the United Utilities, who were really interested in the ideas that this sort of approach might offer in terms of sustainable urban drainage, and take the impact of a combined sewer system in terms of storm surge that Liverpool experiences away, and how we manage that in a much more creative way. So this was about overlaying lots of different things, really, in terms of green infrastructure, access to green spaces, addressing climate change, providing opportunities for community engagement, providing learning space, community space, and really sort of accelerating that opportunity of Liverpool's transformation into its broader communities. Very aspirational, but as I said, this was an idea, it was a provocation really to stimulate discussion and stimulate debate, and hopefully that's what we can do now. The QR code there now is a live QR code. You can connect with that. It'll take you to our landing page, and if you'd like to engage with the idea behind Green Lanes, we'd be very pleased for your participation. So there's a brief presentation. So if you bear with me, I'll now bring the slides back down, and hopefully I can do that quickly. And we should come back with our panel. So, I guess to summarise then, Liverpool Green Lanes, as we've said, was conceived as a provocation, a catalyst for discussion, catalyst for debate, rather than a fixed master plan. It's about building on individual projects already underway or in design, connecting them and hopefully amplifying their impact through agglomeration. To start the discussion, Anisha, Magali, could I welcome your thoughts perhaps on Liverpool Green Lanes? Do you think it's a valid approach that could bring positive impact in terms of city environments that might enable people to live and age well? What do you see maybe as the key opportunities or the challenges in bringing forward such an idea?
Shall I start? Yeah, thanks, Paul. Hi, everyone. That was really interesting. Thank you, Paul, for describing the Liverpool Green Lanes project. I think one of the really powerful things about the project is the fact that you're overlaying different things. There are obviously a huge amount of co-benefits with respect to the scheme, and it's providing a lot of different things to the surrounding community. And I think the key word you used just then was the fact that you're connecting areas and you're connecting activities and you're connecting people, I think often projects are carried out slightly on their own, and so you have sort of different greening type projects dotted around cities, but they're not necessarily connected, or it's not done in a sort of coordinated way, I guess. And I think that works really well in terms of the way you described the organic network kind of spreading through the city, which I really liked.
I guess perhaps there's some parallels there with some of the work that you've been doing at Great Ormond Street.
Yes, there are. I mean, the work I've been doing at Great Ormond Street, just in terms of an overview for everyone, I've been looking at a healthy hospital street immediately outside the hospital on Great Ormond Street. So that, in fact, isn't a network. Ideally, that should spread. At the moment, we're just looking at the streets immediately around the hospital. And the idea is that at Great Ormond Street, and actually often in many hospitals, the streets immediately outside them are incredibly unhealthy and congested and unpleasant and quite stressful. So your arrival experience to the hospital is quite stressful. And we've also come to the realization that, what's the point of treating children with respiratory illnesses in the hospital if they go straight out onto a super polluted street afterwards. So the idea is to tackle that by this healthy hospital street, which reduces there's still vehicle access, but rather than the 2 lanes, it's 1 lane, and then you have that increased width of public realm and pavement, if you like, which we're filling with seating and plants and shade and playful interventions for children to play along. So yeah, in a similar way, there's sort of layer and layers of different co-benefits that are provided by this design, if you like, which we're hoping could be replicated and become an approach that could be taken in other NHS trusts. Yeah.
Great, thank you. Anisha, what from your point of view and experience, what do you see as the opportunities and challenges with these?
Yes, I just want to pick up on something that Magali was saying as well around Great Ormond Street, because when we had a chat previously, it was all about, I think it was your child, wasn't it? You put a backpack on them at that level to actually understand what that experience is like, and they'd done something similar at Pontevedra, which was in Spain, just around safety and thinking about Liverpool and expanding that out. So what they've done is taken out the cars, and almost like the cars look after the cyclists and cyclists look after the pedestrians. And what they've done is then lowered the scale of lighting, so it becomes more of a human scale. And therefore, I'm wondering as well with Liverpool Green Lanes, this kind of bleeding between the outer regions into the city centre, whether there isn't such a barrier between the two, and that then helps with not just safety, but also population integration, with the main driver then hopefully as well to, as I think you said at the top of the conversation, about increasing healthy life expectancy, which we know UKRI has said this, that it's 62, and there's a long way to go to get to what the average life expectancy is as 81. If we think about Liverpool Green Lanes and how we can actually get it to the next stage and bring it to fruition, maybe one of the ideas that Magali and I have been talking about at the NLA, because both on the New London Architecture Healthcare Expert Panel, is whether or not in each of these devolved authorities, of which Liverpool being one, you would bring in a mayor or a deputy mayor for health, and they would almost be overarching over certain areas such as housing, education, energy, because in each of the policies in each of these areas, you'd hope that there'd be some sort of healthcare outcome attached to it as a clear social impact. And I don't think this can just be done separately between public and private. There needs to be this partnership. So maybe at the beginning of thinking about a healthy city or a healthy new town, we bring in a form of a partnership board that are all pointing in the same direction to get to these outcomes over a much longer period of time, 10, 20, 30 years. Mm-hmm. And then take some of those learnings as well from post-occupancy evaluations, which are so rarely done. But we know, again, the work we're doing at the NLA, Barking Riverside is doing quite successfully. So perhaps taking some of those and then infiltrating it around those devolved authorities might be a way forward.
Yeah, thanks, Anisha. That's really interesting. I think we were fortunate enough to present Liverpool Green Lanes, both at Healthy City Design Congress in 2023, which we sort of designed it around, actually, in terms of that opportunity. The Congress move into Liverpool in 23 was a little bit of a catalyst for generating the idea. And we also presented last week at the 24 Congress in Liverpool. And I thought last week at Healthy City Design that there was a clear recognition that addressing health inequality and integrating health into sort of wider community context requires a multi-agency approach. And I guess that's really what you're talking about, that multi-agency approach, and working across those key areas of social infrastructure, including residential and education and healthcare and transport. And actually, Nuala's having some technical difficulties in joining us, but it was interesting, the panel that Nuala was on with colleagues from Liverpool City Council, and that I think they had health as a policy underpinning all of those areas. So when you're talking about a mayor for health, and I think that's a really interesting idea. And what do you think that the barriers are to creating that sort of multi-agency approach? Is it that currently central and local government are perhaps too siloed in their structures and their cultures, or what do we do to break that?
So, go on, Maggie, do you want to go?
Okay, yeah, no, I can just in terms of my experience at Great Ormond Street, I think a lot of the challenges are to do with ownership, certainly, in that as the hospital doesn't own the street, for example, it's owned by Camden and Highways. So there are a lot of different stakeholders involved, and I think we've needed a sort of a little more guidance in terms of how do you establish partnerships to do projects like this where multiple stakeholders are involved. You know, where does the money go, for example? Everything's quite disconnected, and it's quite difficult to find the sort of the regulatory mechanisms and the funding mechanisms and the sort of guidance as to how to do it. I think there's a will there to do it, but due to the ownership of the street maybe not belonging to Gosh, for example, I think that those are some of the challenges that we're finding at the moment.
Anisha, would you like to?
And just adding to that, I suppose from my previous experience, thinking about funding, and you might be having like bodies such as Homes England coming into play here as the funder of first resort, because I suppose you've got the advent of the National Wealth Fund, and where there's an untried, untested concept like healthy cities and healthy new towns, it almost takes the public sector to make those first steps and fund the first, the second, and maybe the third phases. And whilst that maturity then happens, because I suppose the barrier to entry potentially for some of the investment houses, the equity funders, is there's a lot of equity that needs to go in to an untried, untested concept. So once it matures and the level of gearing can go up and they can recycle their equity faster, it means that more assets can come forward, more developments can come forward at a more rapid pace. So I think as well, we shouldn't also forget the planning rules. So we know now with the Labour government, the kind of move to build on the grey belt. And what I'd also be encouraging is, whilst we may be taking into consideration the green belt, conservation areas, etc., also making sure that there is planning policy that builds in what those healthcare outcomes can be, together with what Maggie was talking about. How do you contribute into some of the cleaner streets, the clean air zones, and moving that into the concept of a health and prosperity improvement zone as well. So I think there's lots of opportunity. It's trying to bring, as you said, Paul, earlier, the multi-agency approach together, and funding being a critical bedrock of that. So.
And how do you create those overlaps then and address those gaps between sort of the various determinants of health in bringing forward the planning policy or relaxing planning rules?
So I think if you take something like Liverpool Green Lanes, there was lots of different areas that you were talking about, down to the subsystem. You think about the energy systems as well. So it doesn't have to be, in the case of a healthy city, something which is healthcare related at all. It's population health. If you take, for example, Barcelona, the district heating system there is almost the precipitant for all the development that's coming around up in that area. It's the thinking behind the loads that might be coming forward for the magnitude of development has already been baked in, so that then allows you to bring forward these developments a lot faster. So in terms of those 5 determinants health, if you think about something like the Urban Cities Generator, which again, that was the Healthy City Symposium last year, around density, mobility, transport, that mixed use concept and the proximity to that, environment and landscape and housing and energy, they are all the elements that, as I was saying, could potentially sit under this sort of Ministry of Health within a devolved authority.
Yeah, I think just building on what Anisha was saying, is we found it really important to try, and what was seen firstly in terms of the Healthy Hospital Street as just an air quality project or a highways project, meaning that we'd only ever meet people in Camden and from the highways team. It took a while to actually make people realise, I suppose, that it was also a place shaping project, a safe and sustainable transport project, a climate resilience project, and to kind of get all those different players from Camden and the various different organisations we're working with around the table. And I think that's part of that is a communication issue. And just in terms of Anisha talking about Barcelona, I'm in Barcelona at the moment as it happens, and we were walking around yesterday, and they've got some great urban interventions here at the moment. They've sort of pedestrianised one long street in the grid system here by called the Champla. And what I really liked about that, well, firstly, that it's created a fantastic kind of space, but there's some really good information panels for the public to actually see and understand what it's doing, so people don't just think, oh, I like those plants, look, and I like to here because there's a bench here. There's some great diagrams explaining what the plants are doing, how the water's collected, how the air's being sort of cleaned. And I think that's great because it makes it very accessible to everyone, and it means, I don't know, I think you're kind of sharing the benefits with everyone, and it creates greater understanding, which I think is important.
Yeah, I think that understanding is key, isn't it? And perhaps sort of staying a little bit with reflections on healthy city design congress last week. There was a sort of wealth of research endeavour that came across during the day I was at the congress. Unfortunately, I couldn't go to both. Everywhere we sort of looked, there was data collection. I did wonder at times whether maybe have we gone too far with a focus on research and data at the expense of focusing on delivering some impactful interventions.
I think you're right. There are a few talks. Helen Pineo, I'm not sure how you pronounce her surname, but she was talking about how qualitative and social research has also been deprioritized, maybe at the expense of just sort of numbers and data. And there were quite a few presentations. There were some interesting presentations in the form of animations, for example, trying to describe the lived experience of people. One was, for example, about the neurodiverse population and how they experience space, and that was done as a kind of animation, and it was really powerful. And I think some of these things have been lost sometimes. And Anisha mentioned an exercise I did with my son. There's a program called Urban 95, which looks at the city from the point of view of a 95 centimeters high 3-year-old. It's the average height of a 3-year-old. And the important thing is that at that age, your environment you're very vulnerable due to the fact that your brains and lungs and immune systems are all undergoing rapid growth. So it's a key stage of our lives. And anyway, I strapped a camera on my son at that height, and we recorded his journey from Russell Square Tube, which is the nearest tube to Great Ormond Street Hospital, to just record the journey. And it showed how the wayfinding was appalling because he was with his dad. They sort of went wrong several times, but also it was incredibly grey. You just had people's bags in front of you, or cars at that height, and it was very hostile, and it was just really powerful way of understanding the experience of a child, in this case arriving at a hospital, and that kind of understanding that lived experience, and that's via storytelling or those kind of methodologies, I think can be really powerful.
Yeah, I think it was a great expression. I think it was Dr. Rachel Turnbull, who we've done some work with in the northeast of England, and she referred to, I think, where data and stories meet, which I thought was a wonderful expression. Anisha, would you like to add anything?
Yeah, just on data and stories meet, I think is more powerful than usually we hear strategy or culture eats strategy for breakfast, because what we're trying to do is engender a culture and a shift, and that I mean, there was an HSJ webinar that I was on probably a year ago, but they were talking about how data innovation, if you think about what happened during COVID, I think Liverpool did a really great job there. They brought together the university, and this was showcased actually last year at the Healthy City Symposium, NHS, local government, and they created something called the Cypher system. But even if you look, I think the world looked to the UK, to be honest, in one of the only national health services in the world where you've got data at your fingertips. So the government asked for a COPI notice, which was basically a control of patient information. And what it did was track that information of what the outcomes were from putting jabs into people's arms. And we need to be really clear that when we're asking for data, what is the outcome that we want from it and over what time period? We know that actually the NHS app is doing remarkably well. So what, 3/4 of the population now uses it, 34 million. Yes, there's a question around data integrity and in a personal choice. On the other hand, however, there's also a real opportunity to use that data that comes through it to help population health in the long term. And we know from the likes of CAV, which is Campus for Aging, and Vitality in Newcastle, they've got this ambition underway. So once that development is in full flux, they will be hopefully having participants there, people living in that campus, that over a 10, 20, 30-year period, you can measure some of those key areas that are affecting a lot of the populations. If you look at something like Core 20+5, you know that for the 20% of the most deprived population in this country, maternity, severe mental health, COPD, early cancer diagnosis and hypertension are key areas that we need to focus in on. And if we can try and avoid those coming to the front door of an acute NHS hospital, then all the better for improving, as I said earlier, the healthy life expectancy.
Yeah, I agree. Let's just change focus a little bit. So, Anisha, we're both lucky to work in organisations that cut across sectors and reach far beyond the UK. What lessons can that bring? Do you see any particular areas of best practice internationally that we should be learning from?
Yeah, I'd probably draw on two key areas. And I suppose the first one, we've not really touched too much on this, is loneliness and how that impacts some of those key areas I talked about in those five areas of health issues. So in Copenhagen, loneliness was identified in a key study recently as being a real marker for poor health and in fact mortality. So you were twice the risk of dying if you had coronary heart disease and you felt lonely. But loneliness doesn't just impact the older age, it also impacts the students of that population. So what they've done is created communal living. So one such example is at Lange Eng in Copenhagen, where they've created this sort of communal dining, communal cooking. They have a farm which helps them subsist so they don't really have to rely too much on the outer world so much. And then they've also brought in, multi-purpose areas such as cinemas and sports areas as well. That's been really successful. They've got really good outcomes as a result of it. If we were to translate that into Singapore, now Singapore, population of about 5.7 million, so not too dissimilar to Denmark necessarily. But we know that by 2050, about 50% of that population will have hit the age of 60 or above. Now, generally, we seem to think that potentially that there is a multi-generational living benefit, that you've got all maybe 3 generations living together and loneliness will not come into it. But what they've found in their experience there is that actually that isn't the case. So you've got children at school, you've got adult children that are going to working excessively long hours. What ends up happening is that the grandparents, or if they're the single grandparent there, just sits there watching television all day. So they've got what they call integrated lifestyle hubs. So one being Kampong Admiralty, is take that as an example. And there they have, not only have they got all your medical services like your dialysis centre, you've got your elective medical centres as well, but they bring in, yes, childcare, libraries, multi-purpose areas, connecting the green parks to transport links from one hub to the other. And that's made it's been a real game changer, essentially. And what we do know is that a lot of what Singapore's housing stock is nationally owned, but there is this concept of a collaborative ownership stake from each of those residents. So, we could compare that back to maybe Barking Riverside, where there is really this strong heartfelt move to co-creation. And so that's not just about we create this space for you to utilize it, but actually you're part of the answer. You're part of telling us what you need now and what will be needed in the future. So I think there are lessons. We can't take it all, but yeah, definitely aspects of it.
So, Michael,
Yeah, can I just add, I was just going to add to that actually, because I've just finished reading a book called The Connection Cure by Julia Holtz, which was really interesting. And that was about essentially social or green prescribing, and the fact that traditionally when we get sick, professionals ask, what's the matter with you? And she sort of turns that round, or flips it, if you like, to ask what matters to you instead. So as opposed to sort of saying what's wrong with you, it's actually what do you enjoy, what matters to you, and she sort of starts to refer the fact to sort of look at how as a not that some people obviously do need medication, but often what people actually need are community activities or classes or gardening or swimming or whatever it might be. And I think just flipping the question then that way, I think was a really different approach to how we speak to people and try and understand what the solutions might be to the problems they're facing.
Anisha talked there about loneliness, also being impacting younger generations and young people. And I guess in terms of what matters to you is interesting in terms of the health and well-being of young people beyond the boundaries of necessarily the health sector. And from your sort of involvement in those areas, Magali, what sort of improvements in the built environment do you think are needed to support young people better? What is it that really matters to them?
Yeah, I think just in terms of a few stats, actually, 25% of our global population is under 18, and I think it's just quite striking that in that large proportion of people, there's very little. We often don't ask them, in fact, what matters to you. We just do things to them, and I would say that a lot of what's happening currently or the challenge we face are going to affect them the most. And I know, for example, teenagers are often not thought about very much or slightly demonized, or there's a sort of lack of trust towards them. And Jan Gell did an interesting study on teenagers in South London, trying to correlate or try and analyze why so many teenagers go to fried chicken shops, for example. And I think the immediate response from a lot of people is like, they're unhealthy, that's typical, and blah blah blah. And in fact, when you started to delve a little bit deeper, they found out that the reasons they went to these spaces were because there were toilets there, they were warm, and they were comfortable, and there was Wi-Fi there. And it just makes you realize that it's just a group of people who just have nowhere to go, or through various cuts and everything else, there aren't as many youth centres. I think that also spreads, for example, to teenage girls. There's a lot of work being done by a great group called Make Space for Girls. That's it, where they kind of analyse the use of playgrounds or parks, for example, and the fact that often they're dominated by these big sort of ball pitches and not many other alternative spaces to go. And actually, it's important to introduce a variety of spaces, just to enable people to feel comfortable. And bearing in mind the increase in childhood obesity, for example, mental health issues with teenagers, London Children's mean happiness score has decreased. I mean, there are so many health issues that sort of just giving access to green space and access to just warm spaces for children to go could really help with, I think.
It was interesting, as part of recent activity on green lanes, we engaged with one of the primary schools along Brownlow Hill, St Nicholas's Academy, and we worked with a group of year 6 pupils on that, and asked them, if we could extend their environment, a school environment, out into Brownlow Hill, and Brownlow Hill was repurposed away from perhaps an underused or transport route into something else, more of a linear park. What would they do? And some of the ideas, I guess, were very predictable. There was not to say that doesn't have a value, but there was play and sport, but there was also sort of ideas about creating biodiversity environments and habitats. Some fantastic things about creating garden space, but also sort of stalls, growing food and making food available for homeless. And so there was a real sort of social awareness and social conscience that came through from that group.
Yeah, I did some engagement with. They're called the YPF. They're children who've been treated at Great Ormond Street Hospital, who are part of a panel that we engage with on various different things. And I spoke to them about public realm and green interventions, and they were so knowledgeable. They were going onto Google Earth and actually zooming into the high street in their local town on like a specific tree to show me how that tree met the ground, and really quite. Well, I shouldn't be surprised, but I was just really impressed by the amount of knowledge and how many ideas they were generating. It's really stimulating discussion.
Yeah, I think there was, again, there's a lot of focus, I think, in terms of healthy environments, being green environments, and I doubt it's as simple as just planting trees. But nature should be seen as an asset. I think it has the potential to enrich city life. Improve city resilience, whether that's through cleaner air quality or providing solutions to urban drainage. I've known that for a long time, I guess, as reference the garden city movement from last century. So why do so many cities still struggle really to really improve on their environments, their green environments?
So, I mean, Maggie and I, again, with the New London Health Architecture Healthcare Expert Panel, are working a piece of work bringing together this concept about green and blue routes and cohesion across London. That's no mean feat. And I guess there's a question around scale and how far you can bring that out. But I think to a question about why it doesn't necessarily happen, there's really good best practice, pockets of it, but it's not joined up. And it's also bringing together this concept of the private and the public sector. So you may have developers, for example, with the Section 106s, with the SIL monies, but this cohesion of what do you do with it and coming to an agreed consensus could be helped with, as I spoke about earlier, this partnership board. But what we also know, and back to that point about safety and potentially girls, not teenagers hanging out in fried chicken shops, is that not only would you potentially bring the cohesion of the green and blue routes together, and yes, it could be a method of exercise and giving them access to it, but also understanding what activities are being curated in each of those spaces is really important. And then getting, again, back to his co-creation point, getting those people to input into what's happening. But I think this really can only happen if you get an organisation in London, for example, like TfL or a Google on side, where you've already got that platform that can then bring that together more easily than starting from a standing start.
I know from our work with London Borough of Waltham Forest, when we were working together on the design of Whipps Cross and not just the new hospital, but the master plan for the residual estate and extending the forest into Whipps Cross, and those ideas of creating a new neighbourhood and working with Waltham Forest. I mean, they had some great ideas, and they've been really successful, I think, as a London borough in implementing some of those mini Holland and things like that.
Exactly. And I think adding to the concept of green and blue routes is also this concept of overarching should be sustainability for any healthy city or any healthy new town. But how do we? So, for example, the ICBs are thinking about this, looking at their totality of the assets. But if we broaden that out to the devolved authorities, what sort of assets have we got? We know the NHS has got the concept of core, flex, and tail. So, core being those assets that are utilised in the way they should be, and they will continue to be. Flex is essentially how do you adapt those facilities to be used for something else, or maybe the same thing but better. And then tail, dispose of. Is there something under this partnership structure where we can really fully analyse all the assets that are within that particular region without having to necessarily build new, but where we do also need to build new, making sure under planning policy that there is demonstration of decarbonisation, proper healthcare outcomes as well. That gives more of a holistic solution potentially to the conundrum of why things necessarily aren't brought forward.
And I think just overlaid onto that green and blue sort of infrastructure that you've been speaking about, you also need a sort of layer on top of that, which is about provision of benches, toilets, fresh water, those kind of amenities. Because I know, having spoken to a few older people in our area in Bloomsbury, that there are individuals who won't take a journey out to see a friend, say, for example, because of the distance, or because there's nowhere to sit, or no toilet, or that kind of thing. And I think that infrastructure is key as well. And because that one visit to your friend a week is helping with loneliness and all sorts of other things, and has an impact on your health. So that's another layer, I guess, we need to think about.
I think you're right, and just really cutting it back to what are the basic human needs, and are they met?
That's great, fantastic. Tom, I don't know whether we have questions from the virtual audience that we'd like to start to take. Is Tom still with us?
Hang on, I'm sorry. Hi. Yeah, so thanks guys, that was really interesting. It's good to hear about all the kind of different projects going on. I guess my first question for the panel, is just in terms of delivery, what kind of issues are there with the planning system and getting these kinds of projects off the ground? There's quite a few which have sort of fallen by the wayside over the years. I mean, one that springs to mind is the pedestrianisation of Oxford Street, which was proposed, I think, back in 2016, 2017. That was scrapped because there was issues with traffic on neighbouring streets being redirected. So just in terms of people on the panel, your experiences with working on these types of projects, what's it practically like working in the UK planning system? What kind of barriers are there, and what can be improved?
I'll try and take that as a starting point, and then colleagues can join. I think that there are successes there, Tom. And, we referred briefly there to some of the successes in London Borough of Waltham Forest. And I think you sort of look at that, and how did they bring those through, and how were they successful? I think a lot of that, to my mind, is about positive engagement and bringing communities along as an integral part of those thoughts and those ideas. And that always sort of struck me when we were working with Waltham Forest, that it was very much community driven. There was some very organised and well-structured community groups. They had health really high on their agenda, and I think it's what we all will be able to look back on is communities hate having things done to them, but they're really receptive to having done things with them.
I also think sometimes pilot projects, even in Waltham Forest, or say here in Barcelona for some of the super projects, there was an immense everyone was very much against them, and a bit of an outcry when they all started. And even in sort of Camden, where I work, I know there's a councillor there who he got death threats when they put in a cycle lane there, for example. But sometimes it takes like a year or two, or it takes a bit of time for people to actually get used to something as well. So you can do that as a bit of a pilot to test out how people might respond to it. And because I think it's sometimes hard to imagine what a sort of difference, that kind of how the difference might affect day-to-day life. It's not as bad as you think it is. I do think that often takes a certain amount of bravery or leadership as well, in terms of moving some of these more radical projects forward.
And Tom, if I were to broaden this out a little bit further, I don't think it's just the planning process. I think it's actually a bit before that's the funding and the business case process that seems to stall this. If you think about some of the projects that do get the funding historically, they tend to be heavy economic infrastructure projects, rather than maybe this concept of what we're trying to bring forward here is healthy towns, healthy new cities. Now, why is that? Well, possibly because the outcomes are deemed to potentially be more qualitative than quantitative over a much longer period of time. And therefore, how do you demonstrate that value to Treasury? So is there an index that we can bring in which might be akin to GDP index, but is measuring this understanding of what a new health index could be. And that's what I'd be really wanting to champion if we could. And it would I would say it would level out the playing field if it had the same respect level as perhaps some of the more immediate outcomes that you might get, as I say, from economic infrastructure projects.
Okay, great, thank you. Paul, your comments lead on to a question we have from Mark Sampson. He asks, can you tell us a bit more about how you engaged with the local community in the development of the Liverpool Green Streets concept? It says both community voices and leaders from various residents groups, but also schools, the local universities, Liverpool One, and the KQ business community.
Yeah, there's quite a lot in there, isn't there? So yeah, as I said, we started this off as as a provocation, really, and to generate a discussion. When we exhibited at Healthy City Design in 23, as well as presenting there, we did have a model exhibit, and we encouraged people to add their comments onto that. And we got an awful lot, actually, and we brought a lot from that. Out of that level of engagement, we then sort of held a little bit of a forum where we invited those that had participated and given their ideas, given their thoughts, to more of an open discussion. And then I think that's what generated, more of a defined sort of stakeholder group, which included some key community organisations, Engage Liverpool, for example, who are a community organisation, Liverpool Waterfront, and they've engaged fantastically, ever since. Amazing sort of group. They've organised and are hosting a series of seminars. First of which was a couple of weeks ago, where they invited Tallinn of Estonia over to talk about their experience as a European green capital city. I think later this week we've got Valencia coming to Liverpool to talk about their experience as a green city. So being able to engage with people like that has been fantastic. I mentioned how we've engaged with the school pupils at St Nicholas's, which is added something to their curriculum, as well as being able to bring their ideas forward, which I think is great. And we also had some fantastic engagement with one of Liverpool's councillors during the early stages, Councillor Jane Corbett, who was also the Marmot City champion, and she engaged and gave us a huge amount of information in terms of how her community was experiencing life in the city, and what Green Lanes as an opportunity could offer to them, whether there is in terms of access to the various other aspects of the Knowledge Quarter or other transformation projects around the city. So it's been at lots of different layers, and continues to be at lots of different layers as well.
Okay, great, thank you. So next question from Ben Smith from Mott McDonald's. Given the current challenges associated with public funded projects, what are the panel's thoughts on the likelihood of public-private finance models for funding of projects like Liverpool's Green Lanes?
Again, I can start, and anyone else would like to come in, though.
I can take that if you want.
Great.
As well.
Yes, please, Magdalene.
I was just going to say, I think in terms of bearing in mind the sort of challenges we face in terms of funding, some of the way Paul just described the Liverpool Green Lanes project just sort of made me realise that there are obviously a lot of organisations that are taking a collective responsibility for the issues that surround their community.
Magdalene, sorry, I think we've just lost you there.
Okay. I'll continue on. So, I mean, some of the ideas would be around flexibility of use. So, in terms of the private sector funding market, where there's alienation rights, where you can replace one tenant with another. So usually something like an office space. You think about the Cavell centres as well, which came to a certain point, which was basically community use, back to Magley's point, of different uses within a space. But if you can quickly replace one tenant with another, that makes it much easier to fund and fund off balance sheet. Therefore, that release, so if the private sector is able to take that up, and if the public sector is able to sign up to those leases, but they probably don't have to necessarily underwrite if they've got alternatives. It's almost that waterfall of, say, if an NHS trust can't underwrite it, then it falls maybe to the local authority, then falls into the ICB, and so on and so forth. So there's always a backup mechanism. But therefore, it leaves things like the acute hospitals to fund their own particular facilities, where clearly they need to make sure that they've got enough funding potentially for a smaller amount of space as well. Because if you're going to try and move more into the community, where actually it doesn't need to be in such an energy hungry building, then there are more avenues and there's more flexibility in funding streams, but also in the types of buildings that we're trying to build. Centre of the Community, Magley.
Sorry, I lost you then. Sorry.
Magley, you were. I can repeat the question if you'd like me to read it again. I know you were about to answer it when you disconnected.
Oh, sorry. Yeah, I was just talking about, I think part of the solution is working in partnership with our neighbouring institutions and taking more of a collective responsibility for the spaces around us. I think if we know that there are funding challenges in terms of our local authorities and the public sector, however, there are many institutions, certainly in our area in Bloomsbury, such as the Wellcome Trust and the British Museum, and where we could actually sort of start to all look beyond our red line boundaries and maybe take a little more collective responsibility with respect to our communities that we find ourselves, and start to work in partnership a little bit more.
Okay, great. Paul, do you have anything to add to that?
Well, I think, again, coming back to Liverpool Green Lanes scenario, at the moment, all of the work on Green Lanes has been self-funded by either by ourselves or by our collaborators. So we haven't. It wasn't a commissioned project. It was an idea that was brought together and has grown. I think there are, hopefully there are opportunities, but it also doesn't necessarily, need to be a grand project. We can start small and scale up, and start small by, building on some of the projects that are already ongoing and just providing the connections between them. And amplifying the benefit that those projects can then offer the city and the communities, and start small, scale up, and hopefully scale fast.
Okay, we are swiftly running out of time, so I think this will probably have to be the last question. This is from Joseph Mulcahy. On what level would one create an index to cost in the benefits of healthy streets? Could that be added into the EU's taxonomy for sustainable activities?
Probably a little bit outside of my area of expertise, but we do have colleagues within our sort of collaborating group, Metrodynamics and Evidence First, who are economists. They have been working with us to look at the potential impact that something like Green Lanes could have in terms of addressing socio-economic inequalities, and whether that that's access to employment, or it's improvements in health, which then takes away the demand of the cost of health in the local economy. Sorry, I'm getting feedback now. Those are the sort of things that we've been looking at. Anisha, I don't know whether there's anything from your sort of broader experience that could come into play.
Yeah, so I definitely think that it's a bit of looking back to look forward. So back to that concept of post-occupancy evaluations, there are pockets and clusters of really good practice where they've been trying it at a much more micro local level. But I think taking that evidence and seeing actually, are there trends and what are the specifics of a particular area and how do we have to flex that index accordingly is really important. And the more macro side of it is creating that healthy living index that could be part of potentially the Green Book business case process. I think there's the micro local and there's also the macro levels that we need to look at when we're creating an index, and what can be bespoke and what needs to be standardized would be my view.
You're on mute, Tom. Tom, you're on mute. I don't know whether Tom's wrapping up. He's obviously not catching on. Oh, there we go.
Okay. Well, I think we're about out of time, unfortunately, but that was really interesting. So thanks, everyone. Hope all of our attendees enjoyed it, and thanks for all the questions. Again, this will be available to stream in about an hour from our website. And there will be another session starting, I think now actually. No, it starts at 2, which is called Unlocking Delivery, Developing Healthcare Facilities the UK Needs. But for now, thank you very much to Anisha, to Paul, and to Magali, and hope everyone has a good day.
Thanks, everybody.
Thank you.